I'm going to introduce Marta Dahiya, and then I'm going to invite her to take you through this deck, and I'll just chime in, because that's what I do. But I just want to say, I think everybody in this room knows Marta, but I was going through the warriors, and I think the second or third warrior was Sophia.
Yeah, Sophia.
And I was going through the board members, and one of the earliest board members was Marta. I was going through donations, and one of the first people to just write a check to SRF was Marta. And Marta Dahiya raises a Syngapian, gives her time selflessly, joins calls with industry. There are a lot of superstars in this room, but Marta has been over-delivering for a very long time. And if you haven't said thank you to her for...
No.
She really has been just a rock in this community. And she's also a great doctor, so it's good to have her input. So what we're going to do right now is let her take you through a summary of all the studies that are going on, because we want you to sign up for everything. You're like, Mike, this is crazy. Yes, it's crazy. But here's the summary, and this is your chance to hear it and ask me questions and say, does this really matter, or why does this matter? And hopefully Marta will answer that. Oh, yeah, do you want to hand those out?
Oh, here, yeah.
And Marta's handing out
I can do it, Marta.
a QR code that does something. I'll let her tell you about it.
Then what we
Marta.
did, thank you, Mike. You
course.
need to stay with me to explain all these studies. Then what we're going to try to tell you is what the studies you can participate or what is coming up to be pending to see. If you can use your phone for the QR code that we're passing out, that's going to take you to a page, a form, a Google form, to answer if you want to participate. You just have to fill up the information, the basic information, and click which study you will be interested to be contact for, and then we pass that along to the coordinators, and we hope to get a little bit more participation. Okay? Then, Mike, how I pass this?
Green button.
Okay, then first we're going to talk about the Syngap study, the ones that are only for Syngap. Then, of course, a lot of them is a repetitive information that we have, because we have Dr. Helbig and CHOP presenting about their study in CHOP. I just want to tell you a little bit what you need to know if you can participate or not. The objective of this study is to know Syngap through the years, to know how it behaves, how the kids behave, learn, experience their condition. This study is very important for us, and what it requires is that you have to come to CHOP. Then it's a study that you have to come to Philadelphia. You have to stay there a full day. It takes the whole day, and it's planned. You have to come every 6 months. That's what they want to do. Then if you can do that, if you cannot do that, let us know if we can help you. But that's what the study needs from your child to happen. The inclusion criteria is every Syngap patient from every age. In fact, Nancy took her sister, and we were very happy that they were there. And you can see a contact person, but for anything that you have, you can contact basically Corey, and Corey will coordinate for Syngap. The next one, this study is a biomarker study that actually is a Syngap SRF grant. And we have 2 places. One was Boston. Boston is done. And in Boston, we got 10 kids with 10 siblings and families. And then we still have to finish UCLA in Los Angeles. Then if you can travel with your Syngapian, it has to be between 2 years old and 11 years old. And you are in citizen, please let us know. We need still 6 people to fill up that study. The study is, you have to do 1 visit, and they do an EEG, and it takes very little. No, Mike, it's like a half an hour visit. Then it's an easy visit. It's not a full day. And then you have to come back a year later and do it again.
Yeah, and it's a QEEG, which means it's just a hairnet. So it's not, there's no adhesive on the head. Drop it on, 30 minutes, you're done.
Yeah, and the rest is questionnaires that you do online, but It doesn't require to stay too long in LA or the visit, but yeah, you have to go there. And please, we need 6 more patients to complete this study. The next one, this one is very exciting. This study, we are gonna do it with the Europe, SRF. It's a Dutch study, and it's gonna be, I'm sorry, yeah, I should put it was gonna be in Dutch, yeah. Yeah. Okay, but it's gonna be in 3 languages, and it's with Dr. Andrade. We did a study with 14 patients, and we got that study has been an eye-opening, knowing about how's the life of the adult Syngapians. Then at this point, this study is gonna grow. We want more than 40 patients. That's what we are expecting. Help us out to know what happened after the Syngapians get to adulthood. We are looking for 17 years old and older because the study is going to last 2 years. Then in 1 year, where it's going to be 18, then please let us know who is 17 and older.
And if you were in the first 14, you still need to re-enroll. And if you know a family of an adult child, get them to enroll. This is a coup. Dr. Andrade's initial study with 14 was published in Neurology Genetics last week.
Yeah.
And if we can get 40, 50 patients through this one, it's a win for the whole community.
And it was a win, big win. We pass along other diseases that are bigger than us and everything, and we got a publication out of that. Then everybody has been very impressed with the Syngap community because it's a study. And it's going to measure seizures, behavior, medical experience, communication, and it's all online. That's a good thing. It's all online by interviews and by filling up completion stuff online. Okay, the next one is become biosignal. And the good news is they told me, tell everybody by 10 a.m. this morning, they fill up the study already. But it's amazing. They were so happy. They said, this community is amazing. But actually, they think they're gonna extend it to more patients. Then still, please put your name if you are interested to get the band. The inclusion criteria is Syngap diagnosis is 5 years old and older, and the reason is because for the band that they have, you have to be 50 centimeters. That is like how many, 30 inch? No, I don't. Yeah. Then that's more or less when you are 5 years old, you reach to that side. If this study passes and they can see that it functions well for Syngap, they're gonna do the band for pediatrics. Then it's very important that we move along this study. Then, and that one is only on the US for now, but I know you guys are talking with them, and hopefully we get into Argentina.
And it should be in Europe eventually, because the dream is also in Europe.
Yeah, and then the other requirement, you have to have an iPhone apparently but that's it. And they want siblings to use it, then they can compare.
Wow.
Yeah, that's what Jay told me. Yeah. Yep. Then siblings are welcome to use it. When the band comes, I guess we coordinate with Jay, but they want to see the normal sibling too. Okay. The next one is combined brain. And I think you guys have seen Mike always, every time that he does Syngap 10, doing the combined brain, where is next week, where they're going to be. We don't have the list for 2024, but as soon as we get it, Lauren is going to let us all know.
I would just say on this, I mean, we will make sure they are at our conference next year. But in the meantime, if you can do a sample sooner, we can send mobile phlebotomy to your house. So if you have a Syngap and you haven't given blood yet, let us know. Let's send a phlebotomist. Let's get their sample, because we're going to use all these samples or have them call Aaron. We're going to use these samples to do proteomics and other studies. And the good news is we can pull a vial of blood this big out of a kid, and we can get like some bigger number of aliquots, and we can use those for a lot of different studies. So this plasma is so precious.
And then the special thing about this one right now, we really need Syngapians that are 12 years and younger. We are trying to collect 40 for the proteomics study. That is a biomarker in blood that they were able to check Syngap in blood, but we have to fill up that. Then it has to be before the kids reach out the age that they have hormones and everything, then that's why it's 12 years old and younger. And it needs a sibling. Then it cannot be half sibling, it has to be full sibling, but yeah, if somebody has a less than 12-year-old with a sibling that wants to donate, we need this like sooner than later. This one is like an emergency. Yes, both of them. Yeah.
If you don't have a sibling, it's fine. Let's just get the Syngapian
think,
plasma and
They said the parents sometimes we gotta, yeah, they are like a, but if you get the blood, either way, it's okay because I think they said the parents work at some point. US on, yes.
it'd be better
Unless
if we
you
could.
travel
We
here.
could collect here. Ask Aaron. Not now.
I'm trying to work with like Canada, but there's logistics in crossing the state lines and international stuff. So
Yeah.
we can try to coordinate it, but it takes effort.
Mm-hmm.
So let us know. I'll ask if you're interested.
What about the sibling? It has to be less than 12, the sibling too, no? For the proteomics, not for the other
Well,
stuff.
we have some controls that are not who are
Mm-hmm.
older
Yeah.
on some of the collections. So I'm not sure that the.
I think it doesn't matter for this, but for the one that proteomics that we are doing, really, if we are reinforcing, find the ones that are less than 12, those are the ones that we really need right now.
Yeah, but guys, don't overthink it. Blood goes to biobank. Biobank gets aliquots. Aliquots go to different studies. One of those studies, we need 12 and under and sibling and blah, blah, blah. Whether or not you're in that study, I don't care. I want your blood in the biobank regardless. So if your Syngapian has not given blood, I want their blood. Thank you.
So on the samples, if your child happens to go to the hospital and they happen to have like a spinal tap,
We want that too.
we would want, if we could have other body fluid, it would be like crazy. So just keep that in mind. It takes a lot of effort to coordinate it, but if you think that's happening, please let us know because and you can ask the lab to save it. They can freeze it, and then we would try to work really, really fast to try to get access to that.
Yeah.
Which you should be able to.
It's a good point. It's going to make them nervous, and their first response will be no, but we can get them over the line. We have IRB-approved studies. If anyone's putting a needle in a Syngapian and taking anything out of them, we want it.
And we can get the orders and
Yeah.
everything done.
Yeah, we can get it done. Keep going.
Okay, Citizen. Everybody knows about Citizen, but remember, more is better. And remember, it takes only 10 minutes to get in Citizen, and you have to record yourself. Then it's very helpful.
But I would also say if you have signed up for Citizen and you haven't gone into Citizen and refreshed in the past, say, 3 months, do that now. Like, open your laptop, go into Citizen, click refresh. Never hurts. And if it's you don't need the birth certificate to sign up anymore, and that's good. But just remember, they only collect when you say collect, right? So if you signed up for Citizen 2 years ago, Citizen has no records after when you signed up. So you need to log back in if they've seen medical providers since then and just say refresh. Takes a second.
Yeah, and it's only in English still, but that's the limitation, but very good. Then we have an electrophysiology biomarker of GABA metabolism in Syngapians, and it's a study done in Forward, where I live, with Dr. Papadelis, and we still need 6 Syngapians to that study, and if somebody lives close to Texas, can come to Texas, they're welcome to my house with the Syngapian, but we want to do this study. It's another biomarker study, and it's important because it's comparing us to Forward actually is a big diabetes center, and it has a big Cook Children's is very big in developmental diseases. Then it will compare us to other children and normal children. Then it's an important study. They do something called MEG, and the MEG goes a little bit deeper than the regular EEG. And some of us, or many of us, believe that Syngap has a problem in the deeper brain, not just in the cortex. That is what a normal EEG gets. And we saw that yesterday in the presentation of Dr. Levine, that she found things on the hypothalamus and everything. Then this is a detect deeper. Then, and it's an easy study. It's not regular EEG. It's entertaining for the kid. Then it's not as difficult as people tend to think. Then Look for me if you need that study. I hope we can fill it up. They take supposedly only until 18, but they did a IRB review and they took Sophia, that is 21. Then anyone, basically. It's not that difficult to get that IRB review. Okay, the next one is Fraser. And he's our hero. That's integrating the measurements of key neurobehavioral functions relevant to SYNGAP. Many of us did that study. Remember the ones that you had to click, the kid was looking at the faces and being social or not social. Anyway, this study goes from 2 years old to 60. Then everybody can participate. The limitation is English, is in English. But otherwise, anyone can participate on the study, and it's all online. And
I would just say that there's one typo on here. It's not coming soon. It's live. So KHUBA, KHUBA at jcu.edu. Take your phone out. Email her right now. KHUBA. And if you're in London, it's fine, as long as you speak English. So KHUBA at jcu.edu. I want to do the SYNGAP study. That's it. Send her an email. Every 3 months for the next year, you put a video in front of your kid, you submit data.
And our goal, we sign up the IRB is like for 80 patients, but we promise them we are going to get 200. Then we cannot look bad. Then please help us out, because that's the goal, to get 200. Next one is the ORCA. Again, that's a phase 2. It's going to come again. And the ORCA is a measurement. It cannot measure communication skills. And ORCA started in another diseases, but they are trying to perfect ORCA for SYNGAP. Then the more participation we get, the more measurements we have in case we get to a pharmacologic study. Because it will tell you how your kid, how was his communication before and after the intervention, and also compare with other kids and everything. Then it's very important. It's 1 to 19 years old. It has to be in English. It's all online, and it's an interview. And Kelly's the one doing that one. Then let us know.
Maybe if we said Callie. Callie, wave your hand. She's going to help us do that. She is the contact person for the ORCA. She's been to all the meetings. If you have questions about the ORCA, talk to Callie. But that's also a hugely important study.
Yeah, and I don't know how many patients, but yeah, we'll know more soon, but it's coming soon. Okay, the ones that are with other studies, let's go fast. The RayX, you guys saw that, Simon Searchlight. This is a study that they asked us to find people to participate from the Sheffield University, that's in the UK. It's in English, and if you can participate, remember, every time you put SYNGAP in the map, you can get a researcher. If we get 15 patients, 20 patients in there, it's going to be more than most of the other developmental diseases because it's hard to participate. You put in the map, somebody is going to call back and say, I want to do a study just on SYNGAP. Then all these participations matter, okay? This one is the Brain Gene Project Registry Project. This one, Dr. Connie Smith is involved on this one, but it's a big project. Also, please participate, and all that is in that paper. The next one is a sleep study that is from Dr. Connie Smith, and she has been very helpful in SYNGAP. Then we really want to participate because, of course, we have the sleep problem, and that's probably a biomarker for SYNGAP. Then it's important for all SYNGAPians to participate in sleep studies.
Yeah, this one I would underline. You don't hear much about Connie, but she's a SYNGAP doctor at KKI. She just works tirelessly. She helps our kids. You want Connie to know your name because,
And she knows SYNGAP. She's going to be fundamental when some studies come. KKI is going to be a good place to have the connection. This one, Project Wellcast project, is for caregivers. If you have 12 weeks and you want to find out, it's a good resource to have because it's good to have somebody who can write and say, SYNGAP is such a hard disease for the caregivers because it will give us more resources later on. Then you want to participate in all that. Government look at that, how burning is the disease.
But what they're doing here is they're trialing resources delivered to you as a caregiver. So it's like Wellcast is about getting some support, some mental health training, some peer whatever. It's,
to the caregiver.
If you're like, gosh, I need to do something for myself, sign up for this study.
12 weeks of a study, but it's worth it. And the last ones, then the 4PB, Dr. Grispan already touched on that. This study, we already have a full. Mike, how many? It's 6 kids.
Well, we have it full, but every time I talk to Zach, he says, no, he said, I only want 2. And I sent him 3, and he said, okay, I'll take 3. He said, I want 2 more. I sent him 3 more. I said, okay, I'll take 6. I saw him last night. He said, okay, I need 4 more. So, but for this one, he needs countable drop seizures. So if your kid has like a drop seizure every month, not interested. If your kid is having like repeatably numerous drop seizures per month or per week, they could be eligible for this. Let me know when Zach, and it's not obvious if this will be in New York or in Colorado. So this is a moving target, but if you're interested,
let us know.
Yes.
Most of the studies to accept right now for medication, they require 4 motor seizures a month. Then that's kind of the most common measurement. Then motor seizures, drops, or tonic-clonics, or anything, okay? Then, and this one is in Spain with Fen-Phen. That was a very famous medication for weight loss, but it was working very well in Dravet. Then if somebody's in Europe and has a very uncontrollable seizures, it's a good one to go. And that's it, I think. And thank you so much.